Miss Saldana. Hi, my name is Jonathan. I'm the X-ray tech taking some of your images today. Can I see your wristband? Okay. And can you confirm date of birth for me?
You already signed and you saw the paper.
The reason we ask, man, is just to make sure that you're coherent enough to understand that we're doing the X-ray and that you're understanding that we are taking your date of birth and we're checking your history and your wristband.
Okay, it's 03/11/1996.
Oh, thank you, ma'am. So we're going to have you change from the waist up and remove any jewelry or any other items that you may have around your chest, okay? So I'm going to take you to the changing room and you get changed, okay?
Hey girl, what are you doing? Oh really? Oh nothing, I'm at the hospital. I'm so bored, I want to go home already. Really? I just got my nails done yesterday and I just broke a nail, but I'm going to make Johnny pay for it. Okay, I'll see you later, I gotta go, okay?
Alright, so we're going to take you to the X-ray room and get this going, okay? So what we would do in this situation naturally is we'd ask the medical history. The reason we're asking that is to find out if the patient's had anything that's happened in the past that we may be looking for in the radiograph we're about to do. So, ma'am, may I ask your medical history? Is there anything that's been bugging you that brought you in today?
I've just been having a cough for 2 months.
Okay. And what does it feel like?
Like I can't really breathe, I have a hard time breathing. And I'm not a smoker, so I don't know what it is.
And is there any sharp pain or anything like that?
No.
Okay. And smoking, are you pregnant?
No.
Okay. And did you also do your pregnancy test before?
Yes, I'm serious.
Okay. And any surgeries you've had prior?
No.
Okay. So we'll take you over here and get this X-ray rolling. What I'll do is put some hand sanitizer on. We always want to sanitize our hands before we go into our X-ray. 2, we always want to have our gloves ready. I'm never going to go into an X-ray without wearing my gloves. Make sure that your tube is centered. Usually your tube has arrows on it indicating where it would be centered, and you have your SID set at 72, which we are centered so you can see the arrow. So next thing we'll do is we'll be ready to set up our patient for this X-ray. So ma'am, since she does have long hair, what we want to do is get her hair at least up in a bun so it stays out of the image. So could you put your hair in a bun, ma'am? Her hair out of the area of interest, we go into our positioning. So if you could step up to the IR, man, put your chest against it, rotate your shoulders forward for me, and also get your arms to the side and hold these arm around. Now the reason we do this is to get the scapula from the lung field and also get your clavicle out of the way of the apex of your lungs. What we do is make sure that the patient isn't rotated at all at their hips and that they are aligned straight with the IR. So this should be a straight back. We want to make sure as our central ray is aligned with her mid-sagittal plane and that is at the inferior angle of her scapula. Grab our shield. You never take an image without your shield. Ma'am, I want to put the shield around you, okay?
Why?
The reason why we want to put the shield is because you're of reproductive age and it protects you better, okay?
Okay, I guess.
Okay. So since we are doing a PA image on this one, we'll have our shield facing on the back end of it, okay?
Before taking the exposure, make sure your console is set with the right technical factors. Every institution is different, but in this case, we are using 110 kVp at 4 mass.
Now I'll give you your breathing instructions, ma'am. I need you to take a deep breath in, exhale for me, take another deep breath in, and hold it. And breathe normally. So now we'll take our second image, which is going to be a lateral image. So what I'll have the patient do is, can you step away from the eye armor? I want to pull out the arm rest so that the patient can rest their arms during the lateral position of the X-ray. And can you step back towards me, facing towards me, ma'am? Now may you also rest your arms on top of the arm at the higher point there. Thank you. So as you realize, there's a gap of OID to IR here. So what we want to do is get the patient to move slightly over so that there's a very minimized gap. So if you could take a little baby step over, man.
Yeah, we can, yeah.
There you go. And you can remove your arms slightly too, man. And rest them back up here. So what you may also realize is that we want to get the IR now matched up with the mid-coronal plane. So I'm going to get the patient to step forward just a little bit. Now we have it aligned. So the IR is aligned mid-coronal. Also make sure that there's no rotation from the hips. So you're going to make sure that there's no rotation. Slightly feeling their back, making sure that they're even. So you can slightly rotate this way. There you go. We will also move over our shield. Since now they have changed their position, so should the shield be moved around as well. And we also want to remove our marker over to the other side. It should be placed right underneath the patient's arm.
For the lateral image, we will keep the same 110 kVp, but go up a notch in the mass, making it 6.4.
So take another deep breath in for me, ma'am. Exhale. Take one more deep breath in for me, and hold it. Beep. Breathe. All right, ma'am. So you can relax. You can have a seat right here. Move this out your way. And what I'm going to do is I'm going to process the images real quick and have the radiologist take a look at them, and I'll be back, okay?
Was there anything wrong?
I wouldn't be able to tell you that, but what will happen is your doctor will be able to tell you within 24 hours, okay?
Okay.
Alright, so I got some radiographs for you.
Okay.
You just did a routine chest x-ray.
A proper chest x-ray should show at least 10 ribs, the apices of the lungs, cosophrenic angles, air-filled trachea, sharp outlines of the heart, no rotation, and proper collimation.
Looks good. She can go home.
All right. Alrighty, man. So, the radiologist has used your x-rays, and they'll be able to give you your results in 24 hours, okay?
Okay.